Good afternoon. My name is Arthur M. Broncho, chaplain of the Nez Perce Tribal Executive Committee. And I would like to say a little prayer before we begin. Honey, what? We give our thanks for this day. Today we are experiencing and enduring the sickness that is affecting our well-being and our daily lives. I pray for strength for our people, and I pray for understanding of what's going on today with this virus. I pray for our people to understand what's going on. Changing a way of life brings fear among us. But again, to understand what's going on and what we have to do to prevent this virus from spreading, we must adapt. And then what I pray for our people to understand and to adapt to this virus. I pray for everybody that is working, our frontline workers. And I pray for our people. I pray for our people to understand what we're doing today. Here, helping to try to protect our people. Again, Creator, give us strength and courage to go on for us today and for our future generations. Pray for the people who are affected by this virus. Help them to heal. But again, Creator, I pray for our people to understand what is going on. And I pray for our people to understand what we can do to fight this dreaded virus. We must adapt. Again, Creator, Katsuyaya for this day. Katsuyaya for everybody. Yoku, amen. And I'd like to further on introduce our tribal chairman for the Nez Perce tribe, Mr. Shannon F. Wheeler.
Thank you, Mr. Broncho. Good afternoon, Namipu. I'd like to thank Chaplain Broncho for the words today. You know, as we continue to go through this pandemic and work our way in, you know, we're looking at 5+ months, 6 months into this, and you know, looking at vaccines and you know the timing on that may, you know, when they do get a vaccine, how long is that going to take for that to get to us? So we must remain vigilant with the things that we do know that works, the recommendations coming from our EOC and our medical staff and the CDC that provides that help and guidance to get us through this difficult time. As of today, there are 93 positive cases as of 8/19, and currently 52 of those cases are being monitored. So there is an uptick in that those numbers as of late. As the great Nimipu warrior Two Moons tells of a story of riding into a battle where one large man was holding back other Nimipu warriors. The large man was from the Blackleg tribe. Putting up a great fight, Two Moons sprang from his horse and went after the man, both of them carrying rifles. Both shot at one another, but missed. The man larger than Two Moons began to run. There was a concern of chasing the man because there was a chance Two Moons could be shot himself. But Two Moons continued to fight regardless. He dodged bullets and got just close enough for a shot. Two Moons defeated the large man. Share this story today, as many stories that tell of Nimipu being great warriors. We have always been great warriors. We have been through several battles, and we're still here, still fighting. This pandemic is another battle against a large enemy. And just as battles before, we all have to play a role in this fight. We need everyone in this fight to come out on the other end safe. We need everyone to help us fight by staying home as much as possible, limiting your travel, wearing your mask when around others, washing and sanitizing your hands regularly, cleaning high-touch surfaces often, and staying home if you're not feeling well. Nimipu Health has been testing diligently, especially for the last couple of weeks. Based on the trends, what they have discovered is that the positive cases are results of actions taken on personal time. This includes traveling and gathering. What that tells us is that we all need to take our behaviors and personal choices into consideration. When we make choices on what to do in the evenings or during the weekends, we should be asking ourselves, will I still be safe and able to follow safety protocols? Will I be in a location that is known as a hot spot for the virus? Who might I be bringing the virus home to if I'm exposed? It is also important that accurate and timely communications occur with our medical providers. While there are testing limitations, if you have it, it is recommended to wait approximately 5 days after an exposure to a positive individual. If you've been in direct contact with a known positive individual and are experiencing symptoms, please call your medical provider to be tested. Additionally, if you do not test positive, it is vital that you stay home and do your part to aid in the contact tracing process. If you are waiting to be tested, take appropriate actions immediately, and as precautionary measures, stay home and self-quarantine until you hear back from your provider. Medical staff are doing all they can to return calls in a timely fashion. They have been adjusting their processes to try to accommodate and significantly increasing call demand. Your understanding is greatly appreciated. If you test positive and are symptomatic, you need to isolate for 10 days. If you are asymptomatic, which means you are not showing symptoms but have had a positive test, you need to isolate for 10 days from the date that you were positive. If you are directly exposed to a known positive individual, you must quarantine for 14 days. If at any time during that 14 days you begin to develop symptoms, call your medical provider to see if testing is necessary. An important note here is that even if you test negative, but were in direct contact with a known positive individual, you will still need to quarantine for 14 days. Your test is a point in time result, meaning that even though you tested negative in that moment, you could still test positive during the time that you are in quarantine. To reiterate that, if you have been in direct contact with a known COVID-19 positive individual, if you test negative or positive, you must stay home and away from others to reduce the risk of added exposures to others. Capacity of testing is limited nationwide. We are fortunate to have one machine for rapid testing that provides same-day results, but it still can take up to 16 minutes to run a test. We have testing swabs that do mass testing, but the turnaround time is 4 to 16 days, which proves to be ineffective clinically. Nimiipuu Health has opted to test in their lab to get results at the time of testing, but are limited to how many can be run. It is recommended to wait approximately 5 days after an exposure to a positive individual before testing. This is why if you have been exposed, consciously make the decision to self-quarantine until you can get tested for the protection of everyone. Nimiipuu Health requires 5 days after exposure before testing so the viral load can be high enough to capture and make the test positive. If we test too soon, then the test may be falsely negative and perhaps wasted. The testing protocol is to wait at least 5 days after exposure and or onset of symptoms to improve the test results. Due to the testing limitations, we have to prioritize the test for those who are symptomatic. With community spread now in our community, a known contact is not necessary for testing. We have confirmed with the Public Health District that contact tracing is responding quickly and within the next day of notice. This has also been confirmed with tribal members. Additionally, testing capacity is occurring with the Idaho State Lab for 48-hour turnaround for results. Through this route, we have tested asymptomatic people beginning on Monday, August 17th, 2020. We are also seeking contracted services through WSU and molecular lab services in Vancouver, Washington to further assist with testing capacity. We have also been notified that the Idaho High School Sports Activity Association requires a clearance by healthcare providers before resuming training. It is not required for every athlete, but for those who were near a confirmed positive individual meeting the exposure criteria, Nimiipuu Health will be partnering with St. Mary's Hospital in Cottonwood and Clearwater Valley Hospital in Orfino. Additional information will be shared by Nimiipuu Health once it is available. We know that most people who contract the virus will be able to survive it. However, it is those with underlying health conditions and are most vulnerable who may not be able to fight it off. We all have loved ones in these categories. We must protect them. In the offices, we have adopted safety protocols that are based on the expertise of medical providers and have proven to be effective. The safety protocols are not an indestructible suit of armor, but they do significantly lower the risk of contracting the virus. Studies show that masks alone lower the risk of contracting the virus by more than 80%. However, the protocols are only as effective as the people who implement them. What we are experiencing now is a worldwide issue. Though we are all dealing with the same issue, different regions have unique needs and situations. What works in one area won't necessarily work for another. We continue to figure out what works and what doesn't work for us. This is not ideal, but it's our reality. As your elected leaders, we know you can't always see the work going on behind the scenes. We strive to provide transparency without adding to the panic. But while we are trying to figure out what to do next with this pandemic, we are also still fighting many other battles: the dams, Midas Gold, the Clean Water Act, or the Clean Water, our water quality standards that pertain to the Clean Water Act, and several others. I speak on this not to make excuses, but in hopes of creating understanding to how we are fighting this battle. One thing this pandemic is not stopping is our opposition in all of these other battles, and we have to find ways to continue battling all of them to the best of our ability. Each issue is important and vital to our culture and our way of life. We have had several individuals who have added to the positive impacts of our efforts against the virus. Vice Chairman Green represented all 5 tribes in Idaho to ensure that each tribe received a fair allocation of state funding. Secretary Edwards sponsored a walkthrough to implement our own contact tracing through collaboration with the Northwest Portland Area Indian Health Board. Our Manager of Social Services, Jackie MacArthur, made a quick and effective decision to turn around a bus full of youth so as not to risk any additional exposures at the Big Hole commemoration. The Emergency Operations Center has been working with several programs, including the Lapwai School District, to provide recommendation and resources for their safety plans. Nimiipuu Health has and continues to be the lead in all of our efforts. This is just a glimpse of some of the most recent efforts, but there are several others that have stepped up during the time of need. We are all here for the same reason, and we all share a passion for helping our people. This also leads to acknowledging the workload and hours being put in. This emergency situation is the longest running, to date going on almost 6 months. There are several folks putting in long hours and working odd hours during this battle. We are dealing with constant change in health recommendations, which causes constant change in policy and protocols. We know people are feeling defeated and burned out, and we all need to know our limits and know when to take a break. As a team, we have to make sure folks that need and deserve that break are taking it, and the rest of us pitch in to cover as needed and as best we can. We are also striving to collaborate where we can. Different folks have been designated to attend various calls with tribal, regional, state, federal, local, and various other representatives. We are reaching out to those who we personally know that can assist. One example is Dr. Haley Wilson, who, on her own accord, as a concerned Nez Perce tribal member, has been an asset to helping with medical advice and recommendations. Nimiipuu Health also collaborates with Yellow Hawk Health Center from Umatilla regularly. We are extremely appreciative of all those that we have been able to partner with. We want to thank the individuals and families that have stepped up on their own accord to help out by organizing meals, supplies, and other goods for those fighting the virus. It takes a community, and it is truly inspiring to see these types of care. The NPTEC is not separate from tribal membership. We are all connected, and when one tribal member struggles, we all do. We are all being impacted by this virus, and we hurt for the many that are directly fighting the virus. When we decided to revert back to stage 2, we knew that there would be several changes that came along with it. Although an impromptu decision as a safety precaution, we knew it was necessary to take action. The decision came after Nimiipuu Health reviewed the data from a week of testing and discussed the situation with our EOC. Given this, we support the necessary precautions to keep our staff and community safe. Mask requirements in the workplace for staff and visitors, telework where possible and feasible, special accommodations for vulnerable populations if they are not able to work from home, and minimize non-essential travel, limiting group gatherings to no more than 10 people. We all need to work together to ensure the guidelines are followed while continuing to have a tribe that functions. We may be fighting this battle for a while, and while we need to ensure everyone's safety, we also need to ensure we are able to provide the necessary resources that many people rely on. Please continue to abide by the safety recommendations and encourage others to do the same. It takes a community, and if we can fight this battle together, the better off we will all be in the end. Katsia'ia Nimiipuu, stay safe, stay vigilant. Thank you very much.